Welcome back to WTOL 11 Your Day and Wellness Wednesday. We as women, we're the caretakers, and many times we watch out for others before we consider ourselves. February is Heart Month, and high time we take care of us too. Judi Gribble knows firsthand what could be lurking under caring for family, thinking you're fit, and now she's asking all women to take their health into their own hands. Good morning, Judi. Thanks for joining us today.
Good morning. Thank you for having me.
Absolutely. So, of course, this month in February, we're raising awareness about heart disease, and we know it's the #1 killer in America. So we want to let people know that it can be preventable as well. So first of all, though, we want to hear a little bit about your story. You had an issue after a knee replacement.
Right. It was 4 weeks post-op, and I was going downstairs, the basement steps, to ride my spin bike as part of my PT, and I only got about halfway down, and I saw white fog. I felt like I was floating. I felt lightheaded, and the next thing I knew, I was waking up on the cement floor in the basement. And my husband found me, was rushed to UTMC, and I was more concerned about my knee. I had no clue it was my heart. And through a lot of questions there, they said I aborted a sudden death episode. And 200,000 people in the United States every year experience this. Only 5% survive.
Wow.
And so we did a series of testing, and the echo showed that I had an enlarged and weak heart. And then they were going to do some more testing. And I thought, how could I have operated as athletically my whole life at the level I have with this issue? And they said, we don't think you had it your whole life. We think you were very sick with a virus, and it attacked your heart and weakened it. Oh. And I didn't think I had any signs, but 2 days prior to this, I was doing more and more because I was feeling better. And 2 days prior to this, all of a sudden, like flip the switch, I was exhausted to the point I laid down on the couch for an hour and took a nap. This happened 2 days prior to, and they said, that was your warning.
And when you think of heart disease, you don't think, oh, I'm tired, you think pain in your chest or your arm, like you don't think, well, I need to take a nap.
Exactly. So that was, for me, anything I can do to get other women educated if they have this, and it's literally you flip a switch and you're exhausted. And like you say, we're always busy. I just figured I was just pushing a little too hard too soon after my total knee. I'm not back to my game yet, and I've got to dial it back for a little bit longer. That's all I thought. So
what was the prognosis then? How did they treat you, and how are you doing now?
So they did all the testing, and they did a heart cath, and my arteries were wide open. There's no other explanation. So they said, well, we're going to put a defib battery pacer device in, and if this happens again, the defib will jumpstart you back to life, and you'll be good. So it's been in 2 months. It's monitored on a daily basis, but I go in every 6 months and have it checked out, and the battery's still at 100% after 2 years. So I've had no issues. I have no restrictions, and I'm blessed beyond words. So.
And, still exercising and eating well. And, these are the messages that we want to get out throughout this month to take care of ourselves and just be on top of your health and knowing your numbers as well, making sure you know exactly where you are.
Right. If something doesn't seem right, it might not be, and get it checked out. So, yeah.
Yeah. And, as you mentioned, those warning signs are so different for women, too. And it's just not those classic signs that we all think of.
Correct. Yeah.
So on Friday, we are asking people to wear red. It is Go Red for Women on Friday. And, what message do you want to get out there?
I just would encourage people to get on goredforwomen.org and donate. It's a great cause, and I was not even really aware of it before I had this. But I'll tell you what, they do a terrific job and are happy to get any help from anybody. So I would encourage that.
You get on there, make those donations, and help, as we mentioned, the #1 killer. And as we're in the pandemic, and we have been the past few years now, there's a lot of stress, and there's a lot happening in our lives that can really, cut away at our health. And we just need to be vigilant, and we need to be paying attention, huh?
Yeah, absolutely.
Very good. Judi, thank you so much for joining us this morning to share your story. Just letting people know, what could potentially happen, and just pay attention to our bodies and listen and look for those warning signs. Judi, thank you so much for joining us.
Thanks for having me.
Yes, thank you.